Here are 5 reasons for annoying chronic knee pain after an ACL repair. Now, for full disclosure, I'm talking about if you've already finished your treatment with a doctor, with physical therapists, you're no longer seeing healthcare professionals because you're done, they've discharged you. If at that point you're still having knee pain, then that would be the chronic annoying knee pain that I'm talking about. So here are the 5 reasons. Number 1 is over-dominant quad muscles. These are the muscles that are right above the kneecap on the front side of the thigh. Often as you're going through rehabilitation for an ACL reconstruction, you're told to get those muscles a lot stronger. It's super emphasized. But in my opinion, I think it's overemphasized many times, and people end up getting over-dominant quads as a result, and they don't learn how to use all the muscles in their lower leg, in the back of their thigh, in the hip. And so as a result, they are dominant, overly dominant on those quad muscles. When that happens, because those quad muscles all come together to form the quad tendon right here, and then they attach to the kneecap, it pulls on the front of the knee right here, and it can cause pain on the front of the knee. Often it causes patellofemoral pain syndrome, chondromalacia patella, where the cartilage in the back of the kneecap becomes affected, or the cartilage on the front of the thigh bone right here where the kneecap sets on it, that can become affected as well. Or you can get simpler things like tendinitis or bursitis in the area as well. This happens because of that over-dominant quad situation from overworking your quads too much while in treatment. Number 2 is doing too much too soon. What I mean by this is if you're progressed too fast to higher level exercises or activities, I mean like running usually, or weightlifting, or some sport activity like playing the actual sport, maybe soccer, volleyball, basketball, football. All of these are sports that people can get ACL injuries, and they often do when there's an ACL injury, and then they get back to that sport a little too soon. So they're over-stressing the ligament itself or other structures in the knee joints, and that can cause the chronic knee pain. So it doesn't mean that you can't play yet. It just might mean that you should exercise less intensely, less volume, like the amount of time that you spend working out. You have to play around with the variables of your exercise, of your training, so that your knee could take it without any problems. So be careful to not overdo it when you're exercising. Make sure that you work within your tolerance and gradually move up as your tolerance allows you. Number 3 is a loose ACL. It's possible that even if you had an ACL reconstruction, meaning they remade your ACL, they reconstructed that ACL, that ligament deep within the knee, that it can get loose again. Usually it's very strong, and in many cases stronger than the original ACL. Surgeons will tell you this, but because of a variety of circumstances, maybe something went wrong during the surgery, they didn't get the right graft or the type of graft they used, because they use a section of the ligament right here, or the tendon up here, or a hamstring tendon, or they'll use something else. There's new techniques coming out all the time. Depending on what happened there, and then during your rehabilitation, maybe you took a spill, maybe you fell right after surgery and loosened it a little bit. Maybe you did something wrong during the rehabilitation unintentionally, and that loosened it too. Or maybe, what's more common, is you have a way of moving, a pattern of moving that adds a lot of tension to that ACL, and you haven't corrected it yet. And after you have an ACL reconstruction, you go back to moving that same way, and it starts to loosen up your ACL again, and you're going to have looseness in there that can cause popping and clicking, clunking noises, and eventually things start to rub inappropriately. You can get meniscus tear, cartilage problems. In the long term, you're talking about having osteoarthritis as a result of not having the proper stability in your ACL for your knee joints. Number 4, speaking about that motion that isn't good for your knees, when your knees move inwards as you bend them. As you bend, if your knees come this direction. Now I'm doing this in an extreme example, but a more common way is you might bend this way and the knees subtly move in as you're at the bottom of the motion. The reason why that's extremely bad for ACLs is because part of the function of the ACL is to provide stability to the knee while it's bending. And so while you bend your knees like this, if your knees come inwards, because of the angle of the ACL, this is the right knee, it's angled from out to in, from back to front, it tensions it tremendously while it's bent. So If your knees fall in during a bent motion, especially if you're loaded with weights or you're about to go jump up or you're running, you're asking your ACL too much. It's not supposed to take forces in that way. You're over tensioning your ACL, and it's just a matter of time before it becomes re-injured. It's going to get loose up front, but you can re-tear it if that's the way you tend to move. Instead, you have to think about keeping your knees over your feet in every position that you're in so that you don't overstress your ACL. And number 5, the final point, is weak arc muscles in the foot. In the arch of your foot. So this is the right knee, this is the right foot. If you just imagine the bone continuing all the way down, the arch of the foot right here is supported by certain muscles. And if those muscles get weak, then that arch starts to collapse downwards like that. And when it collapses downwards, if you look at the ankle and the shin bone right above the ankle, it starts to move inwards. What happens up at the knee when that arch collapses is it pulls the knee inwards, and it feeds that same motion that I was just talking about in the point before. The knees are going to collapse inwards and put too much tension on that ACL. So it's a combination of looking at the muscles up in the hip, but also in the foot, and those are often not looked at. They're often forgotten or just looked over. And it's important to make sure that after you're done with your ACL reconstruction surgery and you're getting back to life as usual, that you get strong in those foot muscles again so that your arches are supported properly. I'm an expert physical therapist who specializes in helping people recover from problems like chronic knee pain after having an ACL reconstruction. That's my specialty. And so I've got tons of videos here on YouTube to help guide you in the right direction if you're suffering from knee pain and you've already had an ACL reconstruction. I also help people that are looking to avoid ACL reconstructions and heal from their ACL tear naturally. Go check out our playlist. It's called the ACL Tear Help Playlist. I've linked it in the description below. And I've also put our full comprehensive treatment approach at how we help people get their knee pain under control and get back to being very active again, even competitive, and get rid of that knee pain if they've already had an ACL reconstruction or if they had an ACL tear and did not have surgery. We show them how to fix these muscle imbalances. We talk about the foot, we talk about the knee motions, we make sure that they're taking tension off that ACL so that it has a chance to heal fully and be as stable as possible without surgery, without your second surgery if you've already had one. Go check out our ACL Tear Recovery Program. There's a link to it in the description below as well.